My name is Kim Young, and I was diagnosed with breast cancer about 5 months ago. I had surgery 4 months ago. I had radiation 3 months ago, and now cancer is in my rearview mirror. Patients should know that every new step is scary, and it becomes routine, and you find a way to accept it and move through it. I was expecting a call from my doctor on the results of the biopsy, and she told me I had cancer, breast cancer, and I just kind of freaked out when I first heard, and I just decided I'm going to just go ahead and act like everything's fine so I can process this. And once I realized that it wasn't freakish and that this is something that I just have to face and I had to be a big girl about it, I was much better. And then I found out very quickly, we did MRIs and scans and everything else, that I had stage 1, grade 1 cancer, very survivable, and I started calling it the garden variety breast cancer. Really easy to treat and to recover from, and as soon as I had coined that expression for myself, oh, it's garden variety breast cancer, I started to conquer my fear. One of the things that's most surprising is how many tests you have when you find out you have cancer. You have bone scans, and you have genetic testing, and you have MRIs and more mammography, and they had found my cancer through ultrasound. And so it's just kind of one thing after another. Some of the surprising things for me were that the patient really determines the course of action. And so it's good to educate yourself. I got to choose my course of radiation. And the other thing they asked me is, do you want to have a mastectomy or a lumpectomy? For me, I just wanted to get the show on the road. That's what I kept saying. Let's get the show on the road. Let's get the surgery lined up. Let's get the radiation lined up. That's how I deal with this stuff. Like, the sooner we can get it done, the better. Some people like to process it, evaluate things. Just find out what makes you comfortable and then stick with it. It was very important for me to have a great cancer companion, and my husband was terrific. So I really recommend that anybody who has cancer to find that cancer companion. That really helped me know that I was never going to be alone at these meetings, and that I wouldn't hear bad news if it was coming by myself. So that was terrific. I think my advice is to get back to your life right away. And that, for me, there has been some silver linings with the cancer. I'm not waiting for anything. I had been thinking about starting a business, and now I'm starting it. If someone tries to strong-arm me into doing something I don't want to do, I say absolutely not. You become very clear on what you want and don't want. So in some ways, having a cancer diagnosis can be very clarifying and freeing. I think one of the most reassuring things for me was that I have many friends who've been through breast cancer, and they're all here today to tell me that I'll get through it, and they have all returned to their normal lives. Cancer is a chapter in their personal history. It's not something they deal with every day, and so I would tell anybody who's been diagnosed with breast cancer that life will return to normal.